All right, so, good evening. I'd like to call to order the November 23rd, 2020 meeting of the Concord School Board. This is a special meeting to address athletics, our winter athletics. We do have a quorum present here in person. So we will go straight to a roll call. So if, Madam Secretary, you'll call the roll. Let's see who's here.
Okay. Liza Pony, are you here? Here. Tom Croto?
Here.
Pamela? Here. Jim?
Here.
Gina?
I'm here and I'm alone.
Thank you. David Parker?
I'm here, but I'm alone.
Thank you. Danielle?
I am here and I'm alone.
Great. Chuck, are you with us?
I'm here and I'm alone.
All right. And I'm here. So we have full attendance.
Okay, so we have all 9 members of the board. At this time, I will ask anyone, and there are quite a few people in our audience today, that please, if you're not a family member, make sure you're 6 feet apart and distance. We have plenty of room. Looks like everybody's done a pretty good job of it. Thank you. Just let anybody coming in late know. With that, we are here tonight to discuss winter athletics and a recommendation that comes from the Instructional Committee. And with that, I will pass it over to the chairperson of the Instructional Committee, Barb.
So, I have to think of the day now. Last week, the Instructional Committee met to discuss indoor sports, winter sports, and co-curriculars. We had a wonderful meeting, tremendous community support, lots of very solid discussion, and the committee recommended to the board to support the inclusion of indoor co-curriculars, winter co-curriculars for our middle school and high school students. Athletic Director Mello provided pounds of paper, of documents explaining really intricately, specifically each sport and what measures would be taken to make sure those sports are safe. So that's essentially the purpose of this meeting tonight is to bring it to the full board. All board members were here and were able to take part in this meeting, which is always helpful during a committee meeting. So, as chair of the committee, I come forward to discuss this inclusion and hopefully move forward on it.
Okay, thank you.
Yep.
Before we get to any questions or discussion among the board, does superintendent, does the administration or the school district have anything to add from the other evening?
Thank you, Jim. No, we really don't. I think that our athletic director did a very good job at presenting all of the aspects and protocols that would be in place in order for our students to participate in the athletics. But I also want to add that this included co-curricula. So this wasn't just about the athletic team sports, if you will, but also the variety of co-curricular activities that the boys and girls engage in at both the middle school and the high school.
Thank you, Superintendent. The discussion last week at the Instructional Committee was accompanied by a pretty exhaustive or pretty substantial report and listing the various sports associated with winter. That report is available to be read by anyone in the community. It's on our webpage, and you can refer to that at any time. I know that the board has read through that over the last several days. The co-curriculars didn't have as much information presented, so if anyone on the board has any questions with regards to that, they can bring that up this evening. With that, is there any discussion or questions from the board that they would like to pose to either the superintendent or the athletic director this evening? Ms. Higgins.
So what I would like to do is address a very thoughtfully written letter from our school nurses. And from their medical perspective and what they see day in and day out, they expressed some specific concerns around allowing the inclusion of winter sports. And I first and foremost want to thank them, and also to encourage people in our district to come to the meetings and share those things with your voice publicly. It's very, very helpful for community members to hear those things. So when I read the concerns expressed by the nurses, and they're similar concerns that everyone has: close proximity, breathing on each other, being out of breath, closed-in areas, all of the things that we discussed at length at the instructional committee meeting, I went online and looked at the governor's mask mandate and the mandates for public spaces that aren't necessarily schools. So I work out at a CrossFit gym. It is not big. It's not a big room. The most people we can have in there at a time is 10. The windows are open. So I went through all of the modifications and mask requirements necessary to work out at my gym, and it's absolutely manageable. We don't want to work out in our garages all winter, so not one person in my gym community messes with what we're told to do, because it's important to us. It's important to me to get out of my house safely. But I felt that I was going to call Steve earlier to discuss it, but really when I read through it and had pretty extensive conversations with my coaches at my gym, I feel that every concern is warranted, but as a parent, if I knew my daughter could work out with her basketball coach, or might be going to the Y or to a gym or someplace else, I would choose the basketball coach, because the knowledge and the investment in the smaller community, in my mind, weighs out all of the things that these prevent, masks and the distancing and such. So I didn't want to not acknowledge receipt of that email. It was really well written, and it brings up a million things that we think about all the time. And I imagine Steve and Kathleen and Mike and Paulette and everybody involved, all the coaches, will take those things seriously as well. I don't feel personally that it's enough to say no. I think we're not at a place that we need to say no. And public businesses are making these alterations and adjustments safely and consciously. And so as a school district, it's our job to follow suit and make sure that our sports adhere to these updates as necessary, and I have no reason to think that they won't be.
Thank you, Ms. Higgins. Mr. Crush, I believe you have your hand up.
I do. Thank you very much, Mr. Richards. And thank you, Chairperson Higgins, as well, for the insight. So I was not able to attend the entire meeting last week of the Instructional Committee. I was there for part of it, and due to scheduling and technical difficulties both, I did miss part of that, and that was unfortunate. So I do have some questions and some thoughts, and I too read the nurses' letter that they submitted, the email they submitted this afternoon, which I do appreciate their feedback and thought it was very well thought out. So I guess my first question is, and I don't want to be redundant, but do we have a ballpark of how many sports we're talking for winter sports? Just a guesstimate or estimate of the number of sports?
The number of sports, not the number of students, but the number of winter sports. So
Yeah, I'm going to ask that next.
okay.
So, yeah, I'm going there next. I've got
So
a
Mr.
series
Mello,
of questions,
please.
so.
I should know this off the top of my head. Approximately 11.
It's not meant to be a quiz.
I want to say 11 off the top of my head. We
And
have,
look, that's fine. And how many students are we talking?
as of today, we have approximately 260 at the high school signed up, a little over 120 something at the middle school.
Okay, so maybe
Usually, I'm sorry to interrupt you. Usually that number would be approximately 350. So there are some people that look like they're choosing to, do something
Sure.
different. Yeah.
Sure. And then with the other co-curricular, we're talking drama, I'm guessing, just because I know that off the top of my head. Do we know how many, do we have a ballpark of band drama? How many students we're talking total?
Ballpark, Chuck, is probably 30. I'd probably say it's maybe a little over 30, but it's around that, activities.
At the high school, okay.
Yeah, at the high school.
And then do we know how many at the middle school?
I'm not sure.
Okay, and that's fine, thank you, I appreciate it. So, I find it, I'm really struggling with this one, and I've thought about it a lot. So, look, and I get the value of co-curricular activities. I mean, drama made a pivotal impact upon my son and who he is, and went through some tough times. And I can almost say trauma from an early age kind of shaped who he is and saved his life. But that's another story. So I'm a big fan of co-curricular and sports, and I get the value of being part of a team and sports, and I don't deny any of that. For some reason, it's really bothering me that we had 49 people under the age of 18 today diagnosed with COVID-19. It's bothering me that our infection rates, and we have to thank of staff here too, are going up in our state at an exponential rate. That's bothering me. You know, there are a lot of things that I certainly do for my mental health, and Barb, I'm glad you're able to go to your gym. I'm choosing not to. But there are a lot of things for my mental health that I'm not doing now and trying to do the best I can with alternative means. We all follow the news. We all know that a vaccine is on the way down the road, which is, you know, hugely wonderful. That's our Christmas present or our holiday present in my mind. I really can't really, and I guess my other question is, are we voting on this all as one uniform thing? Every sport, we're voting on indoors, outdoors. We're voting on basketball with outdoor skiing. So we're voting on it together. We're voting on drama with, I'm trying to think of another extracurricular, with robotics. So we're voting on this as a block, which I don't know how I feel about that. I'm really struggling with this being the right thing to do. Listen, I know, and I've tried to pride myself in time of school board of supporting what I feel like our constituents, the city, the students, the teachers, what people really, really want. And I feel like at this juncture, I may be going against my rule because I'm kind of going against what I heard last week as the popular opinion. But I do feel in my heart of hearts that I'm going to be unable, just as this motion as is, I'm going to be voting no and unable to support it. Because, look, this is not about the kids not doing the right thing, it's about the students doing the right thing, but with all the right things, people still could get sick. That's the risk we're taking. Students could get sick, teachers could get sick, families could get sick. And I get there's no such thing as a no-risk world. But given the fact of where we are, I mean, we've gotten feedback about the elementary schools now. We've had to pivot and change our learning model to remote at Runlet due to an increase and due to staffing. So, and I know we'll pivot, but I'm just saying, do we really want to go down this path, open this road up? And I know this is probably an unpopular concept, but I don't know if we do. And so I would ask on the board members, I would love to hear people's thoughts. And like I said, I'm probably in the minority here. I don't know that, but I'm kind of guessing that with my magic 8 ball. So the bottom line is, you know, how much risk are we willing to take here? And are we really willing to do it all in one lump sum? You know, it's a lot of students, and I know it's not as many as usual. And kudos to Mr. Mello, kudos to Mr. Reardon, and everybody. This is not about the people and the effort of the students. This is just to me about where we are in safety and where we are in our state. So thank you. Thank you for the time.
Thank you, Mr. Crush. And to answer one of your questions, the board members may make whatever recommendations or motions that they wish. Should they wish to vote at one time, that certainly can be a motion. Or should they break the sports out, that could be a motion as well. It lies within the members of the board as to what motions they make. So I'll just leave it at that.
Okay. Thank you, Mr. Reed.
Certainly. Mr. Parker, you had your hand up, I think, first, and then Liza. Mr. Parker.
Yes, and thank you, Chuck, for that response, and I think safety always has to be our largest concern, and we are seeing a surge. So I am concerned about that. I also am concerned about kids not having outlets for their mental health and for their physical health. And this is not like school that is required. This is a choice, and that families make, understanding that they are taking some degree of risk. Is it for me to decide for them if it's a choice, not a responsibility and an obligation as school is, but if it's a choice, and the organizers, to their satisfaction, have met the requirements of making it safe, is it my role as a board member, and I am ambivalent about this, is it my role as a board member to speak to that? Is it should I say yes or no? And furthermore, I will have a problem if we start to pick, okay, this sport's okay and this sport's not. Again, it sounds like 150 people have chosen not to be a part of the athletic program because they have decided for their set of standards, it doesn't meet the criteria. And I have a great deal of respect for that. We all know that you can choose to stay home, and you can choose to stay in your house, and you can choose to have all your food delivered, and you can choose all those things. As a board member, am I willing to make all those choices for the family? Is that my role? Maybe. Do we want to, is it my role to keep the community safe? Absolutely. So I struggle as well, Chuck, and I struggle as a board member to what to do in a situation like this. So thank you for listening. I've been listening and thinking about this a lot, and don't really have an easy answer.
Thank you, Mr. Parker. Liza, then Gina, then Tom,
Thanks.
and then Pam.
So over the summer, when we made the decision to go to remote instead of hybrid education, it was after these epic meetings where people talked well into the night about how scary and dangerous this virus is, and how one case was too many, one death would be too many, and we just weren't ready to be together in person yet. We shifted to hybrid. There were some kinks in it, but it worked, I think as well as it could have. Now we're back to remote at the high school and the middle school. And I just feel like with cases on the rise, so last week we had this parade of administrators and coaches and student athletes, and they spoke so eloquently and well about how important sports are in their lives. And I get that. And you made such a nice presentation. But where's the presentation from our consulting physicians? Where is the information from our school nurses, who are the frontline workers here? I really think it would be irresponsible for us to charge ahead. We know, I'm not making a value judgment about sports. Sports are super important. I'm lucky, my kids ski Nordic, so they're gonna be fine. They can be outside. I'm not so worried about it. But, with practice, I think the protocols can keep kids mostly safe. The idea of competition at this moment in time, with cases through the roof, is madness, in my opinion. And I just want us to think about this. I know I'm in the minority with Chuck, and you can maybe hear my voice shaking because I know this is really unpopular. But, I'm sitting in a room with a bunch of kids who want to play, and they're sitting really close together. And when you're, I would like to be eloquent right now, as you all were last week, but I'm too nerved up. We're not allowed to sing together right now because singing throws COVID germs out into the world. do we want our student athletes to be responsible for a spike in our school district? I'm just a little nervous. If we move ahead, and it sounds like we probably will, I would suggest that we make a motion that takes competition off the table for the foreseeable future until cases come way down, because why invite a bunch of other towns, even states? I know that some of our teams are really great and they have to go out of state to find, high-level competition. That's madness, in my opinion. Thank you.
Thank you very much, Ms. Poirier. Next, I believe, is Gina, and then Mr. Croto, if you don't mind.
Can I go after him?
After Pam.
So I've really struggled with the decision we made last week. And similar, I know that Mr. Parker and I often do not agree, but in this case, I agree with what Mr. Parker was saying. I don't think it's particularly safe. My child and my husband and I, we're all remote now. We are in our little cocoon. But that's a choice that we made as a family. And we had that option and we made that choice. I understand the mental health aspects. Believe me, I understand. We've been home a lot in the last 9 months. I understand the mental health aspect of that, but I'm not sure that I'm in a position to decide for other families what risk they're willing to take. I also agree with Liza that I think competition right now, with our numbers on the rise, over the last week we were #1 in some of the matrices for the nation for the number of increases that we had, percentage-wise. I'm not sure I'm comfortable with competition, but I do see the value in letting kids practice and letting kids do. I have the wrong terminology, I'm sure, because I was not a big sports person until I hit college, and then we didn't have them. But the inter-team skirmishes, I don't know what their scrimmages, I don't know what the right term is, but it's a small enough pod that perhaps that can be done safely. But I think, trying to wrestle against Nashua or to play basketball with, I don't know, with Hanover. I'm just pulling towns, but I think that's really courting disaster. But I also think that to some extent, this is very much a decision that parents and the families need to make and balance their kids' mental health, their kids' ability to access school and academics through being able to participate in sports and co-curriculars. It's not the decision I would choose for my family, clearly, but I don't know that I'm in a position to choose for other families. Thank you.
Thank you very much, Ms. Cannon. Mr. Croto.
Thank you. So I listened carefully and to to everyone the other evening. Mike Reardon's 7 comments about why kids should be able to continue with co-curricular and sports, particularly as it pertains to the social needs being met and the camaraderie that follows. And I mean it by what I'm about to say. I know, Mr. Crush, your business is in the health field, and I would expect and also honor the fact that you would have your opinion the way you do, as well as my other fellow board members. I differ in this big point. I believe the Concord School Board should hire good people and then listen to them. And we have, so we should. Steve Mello is our athletic director. Coach Munn spoke, others spoke, Kathleen spoke. I have great faith in them. And they have every bit of safety for kids, probably more so in their minds than many other citizens in the city. And if they tell me that they think they've got a plan that's going to work, and they show it to me, then I want them to have that chance. I want our kids to have that chance. We were assured that there are safety programs and safety protocols for all of our sports. I even asked the specific about wrestling. In my mind, I couldn't figure out how you could do that, and I was given a very satisfactory answer. The comments from our kids the other night about what these programs mean to them, that means a lot. That means a lot. That means that these kids are going to get a chance to do the things that they love that they haven't been able to do. And you know what? That's not thinking with your heart. That's thinking with your brain. We know that if they do those things, they're going to be better students. And in the end, that's what we want. I'm also mindful of our district's nurses. They sent us a very nice letter signed by all of them. And they're worried. And they should be. They're the healthcare people. But in my heart of hearts, I think that the school district has a good plan. They are willing to try to make this work and willing to pivot if they need to. Thanks for hearing me.
Thank you, Mr. Croto. Ms. Walsh.
I actually had some questions, and I don't know if
Here.
Can you wait just a second until you get some to the mic? Thank you.
I actually had some questions. I don't know if it's Mr. Mello or Superintendent. What role have the nurses had in the discussions about developing the safety plans?
Can the person speaking identify yourself,
Oh, sorry,
please?
Pamela Walsh.
Thank you.
I can take that one. First of all, the nurses have been critical to our operation this fall. They're indispensable. They were professional. Every time something arose, they were the point people to guide us through the DHHS situation and to give us the proper professional recommendations. So they are a critical piece of this going forward. To say that they had specific roles in the planning of that plan, that would not be the case. Didn't know they wanted to have input, but certainly we took the input of every other, the state, DHHS, NFHS, and many other situations, organizations rather.
When does competition actually begin?
That's an excellent question. Not until January 15th is the first scheduled competition. The thought behind that was it's 14 days from the new year, potential reveling and so forth, so seemed to make sense. The state will allow the 11th, but we thought the 15th would be made a little more sense for us.
Has there been any update on wrestling and the situation around masks and wrestling and competition?
Not since last Wednesday. They'll be practicing with masks. At this point, we're looking for more guidance. Like you said, we're not going to have a competition until the 15th or the 16th at the earliest for wrestling. So there's some time there. We're certainly willing to do whatever it takes. The reason that we haven't come right out and said that you're going to wrestle with the mask is because there are some medical professionals that have indicated that it could be less safe with the mask for a variety of reasons, but we're hopeful that somebody will figure out a way to safely do that.
Thank you. And this is just somewhat, it's not really a question for you, but probably more for Principal Reardon or the superintendent. One of the concerns I've heard from some parents is the balance of academics versus athletics, and in particular science labs and other hands-on activities not happening during this remote period. I appreciate that we're keeping CRTC open. Has there been any thought of allowing some of those activities to continue during remote?
We haven't specifically discussed that because kids are going to be remote. One of the things that we have been discussing is in the past, in the fall, bringing in students with various needs into the school. We've expanded our thinking about that to include maybe 25 kids, 20 to 25 kids in each commons who are struggling for various reasons, not necessarily because they have learning needs, but for a variety of things. So we're looking at those. If bringing kids in for the science labs or for our architecture program, for classes like that, is a possibility, we would love to do that. As long as I'm standing here. Someone's referred to this already. Athletic Director Mello and I, Superintendent Murphy, we all, none of this is easy for us. None of it. Because we know what the stakes are here. What I want to share with you, what I want to reiterate with the board is that you are considering perhaps not having a winter sports season because you are concerned about our students' safety. We join you in that. The other half of that equation is that their health is also, as I think Mr. Croto at least was one person to point this out, their health also includes their emotional well-being. If they're over a long, cold and dark winter, are in a remote setting academically and also denied having a safe venue, and safe I mean in terms of having adults who are making sure that they're masked, making sure that their protocols are followed. If those things are denied to them as well, I think their health is going to be at even greater risk, their emotional health, their well-being. And I urge the board to take that into consideration. We all understand the risks inherent in conducting sports this winter. We're very careful. We've thought a lot about those issues, thinking about whether we can bring kids back in science lab or not. But there's a whole other part of this equation that really needs to be at the forefront just as much about the wages immediate and down the line of having adolescents cooped up for month after month. Thank you.
I'm supportive. I'm one of the parents who have chosen to let my kid play sports right now because I've weighed the bad and the good. I would ask that you meet with the school nurses as soon as possible and try and, it sounds like there may be a resource concern that they have that I would hope we would address, but also they may have valuable input for improving the plan.
Yeah, we'd be eager to do that. I'll do that tomorrow. I mean, those people are wonderful, and absolutely.
And I would ask that we try and think about how we get kids into school for that hands-on learning that they need in other areas.
Thank you. Before we go around, I want to make sure every member has a chance to say something, and then I do want to, we do have public comment in, and we can discuss afterwards. Do any of the other school board members that haven't had a chance to ask a question have any questions that they'd like or any statements? Ms. Smith.
Hey, I guess I don't have anything super compelling or new to add to the conversation. I just would sort of echo what the other members have said who have been on the fence. I've thought about this a lot myself. I actually felt a little bit better about having kids doing sports while our general population is remote. It just seems a little bit less risky for those kiddos who aren't playing sports right now. But I do also agree with what Mr. Parker said about parents having the choice to participate or not, and that's kind of swaying me as well. So nothing really new, but I just wanted to echo that it's not an easy decision for anybody.
Thank you, Ms. Smith. I will make a statement, and I'll just jump in here as I've listened to everyone. And I certainly appreciate the concerns that Ms. Pointier and Mr. Crush brought up about competition and about the spread of the virus. I listened to the students say, that they would do anything to be able to compete because of all the various statements that Mr. Mello and everyone else has made. So before members to make a decision one way or the other of the board, I'll throw out something that I've been thinking about that would be possible that may alleviate some of your concerns. And that is, there will be remote for right through January 14th. And that protects the other students, Mr. Crush, that I know you're concerned about, and the teachers. And we could make this so that anyone choosing to go into sports and compete would just stay remote, if indeed even the whole school district comes back after the 14th. But I'm sure these students would be, if that's the caveat that you would put that would make them allow them to compete. I know that there is at least one other district where they have allowed the competition and the winter sports to go on, provided those students choose to remain remote. And that would be a decision that their parents could make. And I hear Mr. Parker with his in his statements and his discussion that says this is a parental decision and a decision that they make with their students, their children that are involved in this. So before you vote absolutely no, I would consider maybe that caveat or amendment that you would consider. And as we hear from others, just think about that. Thank you. Ms. Higgins.
So I'm going to address a couple of things that were brought up that were really thoughtfully good questions, and I have another idea on how to modify the motion a bit. So Chuck, your question about block voting, I am not a fan of voting on 50 things all at once, so I understand where that's coming from. The one thing in my mind that does make this a bit different is that every sport has a very unique, specific list of accommodations that have to happen. So if it was just a sort of a random, yeah, let's do it, that would be really troubling. But the rules and regulations for wrestling are very different than the guidelines and rules for swimming and for Nordic. Reading through that, it was not a short read. Lots of things have been taken in. So that eases my mind somewhat. It doesn't necessarily make it right or easier to vote upon, but the amount of work that went into each individual sport is pretty significant. The other thing that was brought up, and thank you for asking your questions, those are a bunch I was going to try to address. From November 30th until Christmas break, December 22nd, there's no competition. It's all training, fitness and training and drills and all those things that happen in the beginning of a sport. That's one aspect of it. Then we have a break where for the first time families will actually get to have vacation with their children, not at practice all the time. I don't remember a Christmas vacation without indoor track in my life. And then we have 2 weeks remote, so nothing can really happen for the competition portion until that time. So we could make a decision today on the status of the students in school. Another way that we could modify the motion would be to make sure that we schedule a meeting. We have a lot of space and time in January. We could meet January 6th, and if there were things to readdress at that time, we could then make a decision. Gee, it makes sense for these students to be remote. Why don't we do that? Or gee, things are better than we thought. We could potentially continue as is. I always hate to make a blanket decision for 2 months down the road when things change day to day. But I do feel, Mr. Richards, that some modifications or caveats or asterisks in our motion would make sense, so that these kids can get started and know that for the rest of November and December they have their sports, and that we can use current information at that time to modify should we need to. So I'm not saying we're only approving till then. I'm just holding us accountable for getting together and looking at it again in January. Does that make sense?
Thank you. We have Mr. Crush and then Ms. Cannon.
So thank you, and thank you everyone for their feedback. And look, I know this is a hard decision, and in no way do I doubt that our administrators and our coaches and teachers and people involved do not care deeply for the best interests of the students. And I too am concerned about their mental health. I'm concerned about our community's mental health, and it's a hard time. It's not an easy time for any of us. So with that said, a couple questions. And I guess I'll be very honest with you. I'm disappointed a wee bit that our nurses, our clinical leaders, and especially being in healthcare, so that is my point of reference, I'm disappointed that they were not really consulted in developing the plan. So that's a disappointment. My other question is, and I like what Barb is saying, I do, but my question is, how are we informing the parents of the risk and benefits of participating? Are we asking them to sign some type of document that they've been advised of this? Taking it a step further, have we considered doing testing for the students participating? And I don't know if that's the right answer or not. I'm just putting it out there. And the other question is, for example, I guess this includes like the choir and singing. Have we purchased the design resonance masks that are approved for singing and choral practices, and are we going to purchase them if we have not? I guess those are some of my questions in this process. I would love for nothing more than for the students to be able to participate. I agree psychologically, emotionally. You don't have to convince me of any of that. However, I'm also thinking, we talk about the schools, but we also have to think about the impact on our community. I mean, God forbid we have a healthy kiddo get takeout from somewhere and people get sick unintentionally for our community at large from a public health standpoint. And Mr. Croto is right. That is my point of reference. I have great respect for what everyone has said tonight. And still I'm kind of taking it under advisement and still considering the option. So thank you. I look forward to hearing from everybody else.
Thank you. Before we go to Ms. Cannon, do we have any answers to Mr. Crush's questions with regards to parental information?
Yeah, they had to do that in the fall. Jack, you could speak to the process of vetting the... Go on.
So in the beginning of the year, our insurance carrier had addressed the COVID situation as well, but also we'll have disclaimer that they can sign off on it. They're aware and they understand the risks associated with competing in sports. So,
okay, thank you.
Okay.
Thank you. And
thank you.
His second question, and I don't know if this has been looked into at all, but Mr. Crush asked about testing. Is there any plan on testing programs, or has that been considered?
Well, as you know, part of our plans has a number of sites where families can get free testing. They're listed in our document about safety protocols for schools, so parents can take their youngster to those sites and have tests done. We as a district, however, don't have a testing protocol that we have for our students.
Okay, thank you.
Thank you.
Ms. Cannon and then Mr. Croto. Oh, Mr. Crush, are you finished?
Just one last question. Has anyone looked into the mask for singing?
Yeah.
I'm sorry, I didn't quite hear that question.
Masks for singing.
Oh, yes.
I heard, I didn't know that we, I didn't know that we had special masks that would help that situation, Chuck. It's been pointed out to us that singing is probably one of the most dangerous activities with COVID, and this has been distressful to all of us, and not perhaps surprisingly most of all to our music teachers. Our largest groups right now as cohorts are 20 kids in choir. If we put them in this room, we can probably have them separated by 10, 12 feet each within this setting. So if there are masks that would further cut down on the chance of transmission, that might make a huge difference in our ability to actually offer that. We'll look into it.
Yeah, and the only reason I know that is, I feel like I'm echoing. The only reason I know that is my son is a music major at Clark University, and that's kind of what they're doing, and they're doing very limited, but that is what they've purchased, and he was showing it to me tonight. So something to look into.
Thanks, Chuck.
Thank you, Mr. Crush, and no, you're not echoing. So Ms. Cannon and then Mr. Croto.
I just have a really quick question. So where does Dr. Noble come down on all of this?
Her question was, where does Dr. Noble, what is his advice, Dr. Noble, for our audience or for the people listening at home, is the epidemiologist we have consulted from the, I believe it's Concord Medical Center.
Right. We've met with him since the beginning of the year, has advised us all the way through in terms of the model that we're using, and also we spent some time with him about things like singing and those activities. We also spent a lot of time with him in the fall. We did the same thing, went over all the sports and what he would advise. This winter we met with him again. Both Donna and I and Matt Cashman have been meeting with him regularly, and he obviously supports all of the outdoor sports, all the Nordic, the skiing, anything that was outside he was fine with. He also did support indoor track and field. Indoor track, not field. But the problem with the indoor track is that there are no facilities that we're able to use at this time, so that's been very limited. Dr. Noble had concerns about the sports that have brought the most attention, and that being basketball, wrestling, and ice hockey. He has concerns about, because of the close proximity that students are in when they are, attacking the net in basketball, or certainly wrestling on a mat. So he did not support those three.
Thank you, Superintendent.
Oh, I did forget one. I'm sorry, but cheerleading was also another one that he had grave concerns about for indoor. So we have had in cheerleading, as you know, in the fall, we had some cheerleading. We had that spirit group. Did a lot outside, but they also did indoors when they filmed they never competed in tournaments or had competition, but they did videotape their routines, of which they submitted those to the state, and those were done in the gym.
Thank you, Superintendent. Ms. Cannon, did that answer your question?
Yes, so basically, he supports outdoor sports, indoor track, which is not an option, and the other indoor sports he does not support. Is that correct?
I believe the indoor sports that the superintendent mentioned were basketball, spirit or cheerleading, wrestling, and ice hockey. Okay. Mr. Croto first, because he was waiting, and then Ms. Higgins, you can go again.
This is very quick. Barbara made a comment or asked a question about a potential change in sports schedule, so that, and if I heard it right, Barbara, it was that we could agree to have sports begin and no competition until we have another vote in January prior to that. Is that about right?
About right, or at least an update. I mean, if we get to January and it's clear that we need to make a change, I mean, we've done that all fall. If a change needs to be made, it's made. I'm trying to let this get started and play out a bit, and then if we need to readdress and revote, then we absolutely do. But I think we commit to our community that we're going to do this.
So, yeah.
Yeah.
So my question would be to Steve Mello, what goes through your mind when if that were to be proposed? Is that possible, probable, something we would shy away from? And I ask that now because if it were to go to a vote, we typically don't allow community discussion on a current tabled vote or current vote. So I want to hear it now.
I think if we get to that point, Barbara, it's going to be fairly obvious, right? I mean, at no point last Wednesday did we say if things aren't going well, we're just going to keep blindly going ahead. So, I mean, it is a little problematic. It's not impossible. Like, for instance, Everett Arena is going to want to sell that ice, and we're either going to have to buy it and own it, whether we use it or not, or so there are things like that. Scheduling-wise, it'd be tough. Just, you know, Mike addressed the fact that I worry about these kids all the time, probably to the detriment of my own social emotional well-being. But it is, you know, to the nurse's point, the best way not to get the virus is to stay home. That's not the most healthy thing for everybody, and I think, Barbara, you very eloquently describe your situation. You go to your gym, and that's your personal choice. I think what Mike also started to say was you can't underplay the scars that are left on a young person's life from negative experiences early in their life, and we're just trying to juggle it. We're trying to offer what the parents and students say they need in the safest way possible. That's what we intend to do.
Thank you.
Ms. Higgins, and then unless another board member has a question, I'd like to open it up for public comment.
Dr. Noble has concerns about indoor sports, or says don't do them?
My hand's raised.
Right, like so many of them, they leave it up to our decision.
Okay.
So
That's my clarification.
Yeah, I mean, we heard from Dr. Chan, and he said the same thing. He was worried. He said you got to put in all the protocols, you got to put everything in place, you got to make sure you're following all those rules, but the decision ultimately is in the hands of the local folks. So
that's the clarification I wanted.
Can I make a comment, though? This week I've received so far several flyers from various organizations like AAU and Seacoast United for all of these indoor activities. And I'm not so sure that they hold the same level of protocols and expectations as these guys have done over the last 3 months. And I am concerned that if we decide to say, okay, they'll play elsewhere. I'm telling you right now, they're playing hockey right now at Everett Arena. They're playing basketball with AAU. They're already doing that. And quite frankly, there haven't been any outbreaks. I know there's a risk every day and every night. We live this. I'm living this. They're all living this. But I'm telling you that these kids are going to go elsewhere, and they're going to play. And I just feel that the Concord School District has put into place enough protocols and safety measures that will keep our kids safe. I am very intrigued by the idea of creating some pods for basketball, wrestling, and those ones that are a little, challenging that we worry about because of the close proximity of the players. Hockey is one of those, because if you wear your masks, you're wearing a mask, like Chuck talked about with the music people. There's a plastic mask and that covers them. But this week I have got a ton of these flyers, and I've not sent any of them out because I don't want our kids out and about. The other thing is our kids don't leave the state. They're all here. They're all going to be in regional settings in their games if and when they can play their games come January 15th. So I know you have a tough decision.
Thank you, Superintendent. Mr. Mello.
I would just say the key word is safer. You know, nothing's safe. It wasn't safe when you came out tonight. I'm not being flip at all. I mean, we all make decisions every day on where we go and what we do. To support what Superintendent Murphy said, they're going to be a lot safer with us. I mean, we are taking an over-the-top, cautious approach that I can guarantee you is not taken in other venues. I talked to one of our teachers today whose son plays in various things, and he described it at one rink he went to as like the Wild Wild West. It was like, you know, so yes, that's out there. I think they're safer with us.
Okay, thank you. Mr. Parker. Mr. Parker.
Yes, just quickly, thank you for all the different opinions on this. I don't disagree with anyone, actually. The need for an amendment, though, seems unnecessary. We met last week. We had the full board meeting this week. I think as a board, we've been incredibly as responsible as we could be in terms of making our board meetings public and notifying people and calling them, you know, at a moment's notice to deal with what is the newest challenge or the newest reports or the newest whatever. I have found the community, as well as the community that I work in, incredibly responsive as we segue from remote to in-person to remote. People are used to that. So I think that we will always do the right thing if things become problematic as a board. I don't think that that necessarily has to be part of an additional amendment, because it just complicates things. And as Steve Mello said, you know, does that void our contract with someplace like the arena? It's no guarantee, then we're gonna, you know, sell it out to someone else. I just think we don't need that because we do it anyway. Thank you.
Thank you, Mr. Parker. Mr. Dunn, are we ready to go to public comment? So,
You want to start in-house?
let's start in-house, and thank you very much for taking care of the disinfecting and protocols associated with the microphone. Appreciate your efforts. Is there someone present in the auditorium that would like to make a public comment to the board? Yes, please come down. When you I will ask you to adhere by our public comment requirements and policy, which is that I'll ask you to please state your name, and please limit your comments to 5 minutes or less. Thank you very much.
Gotcha. My name's Marty Pegnum, and I have a son who's on the hockey team. I'm also the president of our booster club. And I just wanted to say thank you all. I know you're in a very difficult spot, and I appreciate you giving us the ability to make a few comments. So a couple things came up that I wanted to make sure that we addressed. First of all, as a booster club, we have very active parents who are so ready to reinforce the safety requirements that Mr. Mello and our coaches put into place. We also have 3 experts on our team. We have 2 moms who are ICU nurses at Concord Hospital, and we have another nurse practitioner who's in the audience who we go to and who I know I can volunteer. If you have a nurse committee, I'm publicly volunteering them to participate in that. But they are an incredible resource for us as well. And something else that came up, recently all of the hockey players in the state of New Hampshire did get tested for COVID, and I did confirm, I think it was 400 that play in Everett. None of the Concord kids did test positive during that time frame, and we do know Everett has some of the strictest, best requirements to keep the kids safe there. And the last thing I wanted to say, something that Mr. Reardon said last week that really resonated with me. I think about it every day. You know, he said we can't cut these kids off from their peers, from school, from activities, and expect them to be okay when this is all over, because a lot of them won't be. And, you know, when you think about either school plays or dance recitals or sports, you know, we teach these kids never to give up if they forget a line, if a costume malfunctions, if they're playing a more competitive team. They have to stick with it and give it their all. And I'm just asking for all of you to really give this a chance before you vote against it. And the one last thing I will say is that sports like hockey, even pre-COVID, I had people say to me, oh my gosh, I can't believe you let your child play hockey. That's so dangerous, you know, and it can be, and that is a risk that the parents take. And I do appreciate a lot of the board members saying that it should be up to the parents, because again, it's a risk we've taken since they were this big, and we're just hoping to have a choice. And again, we appreciate your time, and thank you so much.
Thank you for your comments. Do we have anyone else who would like to make a comment? Please come down. Sure.
My name's Patty Sargent, the mother of triplet boys, senior wrestlers, and I'm also a pediatrician at Concord Hospital. I really appreciate the opportunity to be able to speak tonight, and I'm hoping that our children will have the opportunity to play winter sports. The American Academy of Pediatrics has not come out against sports, nor have they come out against school. So I think that, you know, we need to take precautions, we need to make things safe, but no one from, you know, our governing body has said that sports should not happen. Children are known, you know, of what we know of COVID, they're less likely to be infected, and when they do get infected, usually their infections are more mild. I can tell you in my own experience that, and I work in the hospital, as a pediatric hospitalist, I've seen minimal children with COVID, and I've seen an absolute explosion in mental health admissions. The vast majority of the kids that I admit now are kids that are coming in that are struggling greatly with their disconnection. These are former kids that were athletes, kids that were involved in activities that are no longer, that have just become completely, you know, disconnected. And I think that needs to be taken into account. You know, certainly I'm not downplaying the risk of COVID. However, we're not talking about, you know, geriatric sports. We're talking about pediatric patients. We're talking about children. And I think the risk is lower. Certainly there's never going to be any, you know, this is never going to be no risk. We're going to have that risk, but I think when the kids go back out into the community, they need to wear their masks, they need to be responsible, they need to be responsible at school, and I think if they do that, we can do this safely. And I think if they're, you know, we start to have outbreaks, then we know that we need to simmer this down, but to shut it down before giving, you know, before, you know, seeing what happens, and particularly we're seeing in the fall, there were not great issues. So, I mean, I think that you're cutting off kids' lifelines, and I think that it's dangerous to, you know, children not to, you know, have the ability to play sports and to, quite frankly, be in school. So, like I said, I hope that you consider that, and it's not just a matter of, you know, I think we need to balance, you know, fear with reality, and you know, we need to, you know, do something for our children. Thank you.
Thank you for your comments. Next.
Hi, I'm Ham Manel. I'm a teacher at Concord High, and I'm the wrestling coach. And I want to thank you guys for all your time. And I know this is a difficult situation and a decision that you guys got to make. And I appreciate that. I do. I also want to thank the administration. You know, not just for the sports support, but just they've been working their butts off all year. So I really take my hat off to them. But I'll tell you, Steve has done an outstanding job here putting together this, the plans. He is well thought out in his recommendations. And it sounds like he didn't take the nurses into consideration. I think he's worked hand in hand with them all year. I think he knows a lot about this stuff, particularly when it pertains to sports. So I think he's done just a great job. So I just want us to have a chance to do this thing. You guys can pull the plug tomorrow. You can vote yes today, say no tomorrow. It will never get to the vote, because if it goes that way, they'll shut it down before it gets to you guys. Having a vote in January to determine whether you guys are going to continue on, it won't even get there. If this goes south, it's over, and we all know that. I know that. I think every kid knows this. Every parent knows this. Just give us an opportunity to put our plan into place and give it a shot. These kids need us. We need the kids, to be honest. I need the kids, too, personally. It's hard not to be around them. I've been kind of shut off from them because of we don't have any clubs anymore, no weight training, nothing. But, some kids don't need anything, but they come out for the program they just want to be a state champ. They're strong, they're good, they don't need much help. But there's a lot of kids on my program that need a lot of help. And, I am cut off from them right now. I can't get to them. I see them very little, and they're kind of floating away. And I'm not sure what to do. I need to pull these kids back in here to help them, to save them. And again, they don't all need it, but some of the kids on my program need it. And it's important for us to get that opportunity. But I appreciate your situation, and thank you. I just hope we get a chance. Thanks so much.
Thank you.
Hello, my name is Jack Sargent, and I'm one of the captains of the wrestling team.
Can you be sure to speak into the microphone so that everybody at home can hear you as well?
Oh.
Thank you. There you go.
So I'm one of the captains of the wrestling team, and I'm Jack Sargent. I just want to say that there's a reason there's a lot of kids here in support for this, because they want to do it, and they will do everything they can to do this. Like you said, someone brought up being remote during competition. I think a lot of the kids will do that. Like, if we can have the chance to do all of this, we will. And, I think, like someone said, there's one COVID death is too much, which is true, but also one mental health death is too much. There's a lot of things you can say like that. And I think that's really important. I think almost that there will be more risk of mental health than kids of actually dying from COVID. And, that's not downplaying COVID, that's just how it works. And there's definitely an obligation for all of us to be responsible in our community for people that are more at risk for it. And that's just part of who we have. Everybody in this room has to be responsible. Our grandparents aren't coming to Thanksgiving. We're doing things like that. Everybody's making sacrifices. We're just asking for a chance and an opportunity to be able to do what we love, be with the kids we love, and that's what I think most importantly is. And that's why there's so many teams, mostly teams here, basketball, hockey, wrestling. And I just think it's important for that. That's all I gotta say. Thank you.
Thank you for coming down and making your comment. Thanks. Let's go say there's a gentleman over here that's been waiting for a while. Let's have him first, and then, thank you.
I got it.
We have plenty of time for everyone.
Good evening. My name's Tom Philbrick, and I'm a father of Ryan Philbrick. He's a junior, and he's on the hockey team. And there's a few things I heard tonight. Well, number one, thank you. Thanks to everybody. Thanks for listening. You guys have been very patient, and I know there's some differing views. I also think that one thing that I've heard some maybe inconsistencies, and also some things that might not be true, or maybe your impression of what's going on right now. It's been said that these kids are playing sports, or they will go play sports. They are. They're competing right now. But they're competing safely right now. I look back there, in that side right there, and every one of those boys played hockey this weekend, and they have been, many since the summer. Was it irresponsible? Are we irresponsible parents? No. We are just as concerned about their safety, if not more, than, as concerned as you are. We understand that. We understand the safety factor. We also understand the risk factor for athletes of this age group. It is a very, very low risk. You can't argue with it. It's a low risk. Matter of fact, they might be more at risk with just the sports they play of other types of injuries. I don't want to get dramatic. I think some people have done some really put some good cases out there for the mental health. That is absolutely real. You are ripping away years of these kids' school life that's stamped in all of our head. We remember our high school years. It's incredibly important for these people, for our students to come through high school and have a good feeling, school spirit. We have basically experts in this crowd that have put together all the protocols. Most likely the reason that Athletic Director Mello did not consult the nurses on how to situate the hockey team at the Everett Arena is because he has an expert in Duncan Walsh that works at the arena, knows the square footage, knows the protocols when you come in, knows the dangerous situations that they could be put themselves in, and then he's going to eliminate them. We're not going to do this, and this, because this is unsafe. These kids have become so disciplined, whether it's in wrestling, basketball, whatever sport it might be. People talk about Nordic. That could be just as risky. Who knows? It's about letting your guard down when you least expect it. It's not necessarily about sports that have bigger pools of players. Hockey is done incredibly safely. There are masks, and then there's masks over the mask. Really, these kids are so disciplined. All we're asking, Dave Parker, Miss Cannon, Mr. Crush, you mentioned that your son has engineered a mask. They've engineered a mask for singing. That means we can engineer hockey seasons, basketball seasons, wrestling seasons. We can do it. These guys are willing to do it. You have motivated students out there. Let's give them a chance. Thank you.
Thank you, Mr. Philbrick, for your comments. The young woman right there, you can come, sure. You're next.
Then you can go.
I'm not a public speaker. My name's Dawn White. I have 2 children in Concord High School, a senior and a sophomore, who both play basketball. And I am just here to beg you to give them an opportunity to do the sport that they love. As the superintendent pointed out, these kids are playing in AAU leagues. This is where they're safe. They're safe coming to Concord High School, playing with their peers, and not having to travel outside of New England or New Hampshire or wherever to play the sport that they love. They just need the opportunity to be able to do it. I think that Concord has done a great job. Our AD has done a great job of putting precautions in place so that they can do the things that they want. One of the things that also came up with was going remote. If you're going to have students playing a sport, that if we decide to go back to a hybrid model, that if they're playing the sport, that they go remote. I think there could be other options for that. I don't know that that's a necessity in something that should be decided upon now. I think that's something we should look at in the future. My daughter goes to CRTC. What would that mean for her if she's still playing basketball? Is she not going to be able to go to CRTC? There's some important things that come into play when that decision is made. I just ask that we really think about it from the students' perspectives and give it a chance. I love the idea that Ms. Higgins pointed out. Maybe we reconvene in January to see where we're going. You'll know at that point if you need to pull the plug, but I think you'll know well before that. Thank you for your time.
Thank you.
Hello, my name is Hunter Jeffers. I'm a junior on the wrestling team. And I just want to speak on behalf of, I play football as well, and I went through the protocol that our athletic director, Mello, put together, and the coaching staff followed it to a T, and we went the whole season without any case or really any threat of a case. So I just want to have that in the back of your minds. But also, people speak on mental health, and we're going into the winter season where seasonal depression is a huge thing in the Northeast with the lack of vitamin D and stuff. So winter times get really hard on people, plus being locked up in their house, not being able to interact. That's also gonna weigh on them. So I just want the chance to wrestle. I know the coaching staff, they'll do anything, we'll do anything. Anybody on the hockey team will do anything, we'll all do anything. We just want the chance to do the sport we love. I know personally for a lot of kids, our coaches are a big outlet for us. Personally, if we're going through stuff, and I just don't think it's right to take that away from kids. Thank you.
Thank you.
How's this work?
My name's Jessica White. I'm a senior and I play for Concord High basketball. So a few things I want to talk about was possibly how you guys mentioned not having competition. I don't think that's something we should decide upon now. I rode for Concord Crew in the fall and we didn't do any competitions. And I think there's a real big difference between doing, obviously any athlete's going to want to play no matter what, but taking away competition, there's a really big difference between just having practices and only no like competitions or anything, because competitions are really where you get that like adrenaline rush and you really get that outlet. We can do it between our teams, but it's never really the same. And again, like I would be willing to do whatever I can to play, and if you're saying no competition, I'm definitely want to play anyways, but that's just something I wanted to say. And then on top of that, saying like going remote too. I think basketball is a huge part of me being able to stay on top of my work and being able to have that schedule, but I know that I personally struggle with remote learning, and CRTC has been huge for me because I've been able to still be in school and do my work, and it keeps me on top of things. But if I'm going to be playing basketball and you're telling me that I have to go remote, I don't know if that, I don't want to speak for anyone else, but personally I think that half defeats like my half of my want for playing sports, because it really gives me that schedule and it really gives me that motivation to need to get my work done. So I think trying to find other options for that would be great. And like what my mom said about CRTC, I'm planning to become an EMT this summer because I'm doing the EMT program, and if I'm not in school because I'm playing basketball, I won't be able to do that because I have to do clinical hours and all of this training that I wouldn't be able to do from my home. So I just wanted to bring up those thoughts. Thank you.
Thank you. Do we have anyone else? Come on down.
Hello, I'm Peter Sargent. I'm captain of the wrestling team with Jack and Abbas. But, you know, mental health for me at least has been a huge hurdle for me throughout my whole high school career. Like I've struggled with stuff, and I've struggled with just a lot of stuff without getting into too much detail. But one person, the people who've always had my back were my coaches in the wrestling team. And, you know, if we don't have that, I don't have that outlet anymore. My guys don't have that outlet anymore. And that's taken away way too much from us. You know, going to practice after school, after having a tough day, there was nothing better than that. Spending time with them and being able to talk to them about stuff and just getting all of it out. I don't know. It just seems. I don't know what I would do without them. And if you take that away, I don't know what I'm going to do. Really. I mean, I'm becoming a firefighter. That's what I've been doing for the past few weeks. But you know, well, months. But if I don't have them, don't know. I mean, I'm also going to the fire academy this spring, and you know, if we move that way back, I'm not going to be able to play sports. So. Don't know. That's all I really got to say.
Thank you. Is there anyone else who'd like to comment from the audience?
Troy Colby. I am a volunteer assistant coach with the wrestling team. In addition to coaching, I actually work in college athletics at NHTI. And one of the huge things I have seen this past year has been athletes that have not come back to school just because they've missed out on the opportunity for competitions. Most of our stuff has been revolving around the fact that we go against schools from different states, so different states have different rules, they have testing rules and whatnot, but that's one thing I want you to think about there. Another thing is a lot of the athletes came back, they've decided to change the eligibility rules for college. There is no change in eligibility rules for high school. That's it. If you take this away, they're done. They're seniors, they're gone. It's it. You know, I think we can make this work. I'm exhausted personally, just working in a gym and constantly telling people to wear their masks, but I'm willing to do that for these kids because they are a big part of my life right now. They are a huge part of my life. And I do not want to put myself in your position, you know, to make that decision. It's definitely a tough decision. Thank you.
Thank you.
Thank you, Troy.
Yes, sir.
Hi, my name is John True. I have twins who are on the hockey team. My wife is one of the aforementioned ICU nurses that Mrs. Pegnam mentioned. I just want to say that I'd like you all to consider on the board what it is that we're really doing here. We've got a number of athletes that are present here, plenty of them I'm sure are on the Zoom as well. They all want to play. The parents of these athletes understand the risks, as Tom Philbrick mentioned. We have our kids playing, we know the risks. Frankly, we don't need other people to tell us the risks or to make that decision for us. That's our decision. The coaches know the risks. They're willing to take it. The athletic director, staff, everybody else, we're all informed. We know what we're getting into. We know what we want to do. So I think really to have a board of directors to make that decision for us is kind of offensive, frankly. We know what we want to do. And the other piece that I want to say is, consider what we're doing to these kids right now. We're making them come up and essentially pledge to do anything. We'll do whatever needs to be done so that you guys will vote to let us participate. We're ripping them around back and forth. We're going to make a decision now to maybe have a decision later, to do all of that. And the emotional carnage it's doing to these guys, it's terrible. They're going through a lot of chaos right now. They've come up with a lot of sacrifices. They've been put through so much since March. It's too much for these guys. Let them make the decisions, let the parents make the decisions that are best for their families and move on with it. I appreciate everybody who has a fear of COVID and a fear of getting infection, and I understand it. My wife's an ICU nurse. She takes care of COVID patients. But that's a personal decision for every one of you. Director Mello has done an enormous amount of work, as have a lot of other people, to make sure we keep these kids as safe as we can. I'm a member of the Concord Youth Hockey Board of Directors. I can tell you firsthand, we've been playing since September, and as Tom and others have pointed out, Marty has pointed out, we've had 0 cases of COVID. 0. We have over 400 players and athletes, players, coaches, etc., involved in this. We're doing what needs to be done. We're following the guidelines and the science. We're doing everything we can. The kids are safer in these environments than they will be anywhere else, or they're as safe. And I will echo, if we do not authorize sports, they're going to play elsewhere. And they don't have the same regulations and guidelines as you will with the NHIAA. You're just not going to have it. But the problem with that is you're going to have kids playing on different teams. They're not going to be together. My kids have friends. You get half of the hockey team up there. Because of the way we've done the school with pods and all of this, Some of these kids have best friends they haven't seen in months. In months. And if we don't authorize the athletics, they'll play on different teams, and they just won't have that benefit of being together and having that normalcy, if anything else. So please, let us make the decisions as the parents, as the coaches who are responsible for these kids. We care about them. I promise you I care more about my kids' health than any of you. Okay? Promise. So let us make the decision for ourselves. And if you're uncomfortable with it for yourself, again, I don't have anything against it, and I respect that, but please, let us make the decision for ourselves. Thank you.
Thank you, Mr. Philbrook. Have anyone else who would like to speak? Make public comment. Not seeing anyone, and I will come back to you again before we're totally done. Mr. Dunn, do we have anyone that is waiting remotely in our Teams group or on the phone?
Sure, 1 second. Okay. Aaron Stewart, you have your hand raised. If you would, please state your name, where you're from. Go ahead and unmute yourself and make your comment.
Hi, my name is Erin Stewart. I'm a Concord School District parent of a child at Concord High as well as Piscataqua. I'm also a Concord School District nurse. I just want to make 2 points based on this discussion. School nurses are public health nurses. Tonight we've heard again and again that people know the risks, but we're not looking just at the risks for our own students. It's true that the individual risk to our students is low. Kids do pretty well with COVID, and 40% of them are asymptomatic, which is a big part of the spread. What we're looking at is the community at large, Concord, the state, the United States, of not being able to go back to hybrid learning or having to close CRTC because of increased cases, because of quarantines, because of having to quarantine staff, because of contacts with students. This isn't about the safety of our athletes, it's about the safety of our town and state as well. I also appreciated Mr. Croto's point about hiring and listening to the experts. He seemed pretty clear about that. I'm not clear then why they're not listening to Dr. Noble and the nurses, who both agree that indoor sports is not done safely. Those are my points.
Thank you very much. Mr. Dunn?
I don't have any phone numbers and no one else with their hand raised.
Okay, then I'll go back to the live audience here. You can come in and make a statement. Just state your name.
Hi, my name is Angela Nelson. I have a junior here at Concord High who's on the hockey team. And I actually work with Patty Sargent at the Family Place. I actually have my master's in public health. So there are other nurses that are public health trained. And one of the things I wanted to bring up that was concerning to me was when you were talking about whether or not we were listening to the nurses when Mr. Mello was coming up with protocol. I remember listening to the school board meeting way back in the summer, the very first meeting that we had when we talked about these kids going back to school. And if I remember correctly, Dr. Jim Noble, who is the hospital epidemiologist, he actually recommended that these kids go back to school and that they go back to school full time. And if you remember correctly, we started the year fully remote. So it's very difficult for me to listen to you guys say things about whether or not we listen to medical experts, because I don't feel that that happened back in the summer when we were discussing these kids starting the school year in September. So that's one point that I wanted to make. The other point that I'm struggling with a little bit is the fact that the fall sports was allowed to happen and that we're questioning winter sports, because while you can make the statement that we're being outside and that it's safer, COVID does not go away outside. And if I think about the sport of football or soccer, those athletes are in each other's faces just as much as they are playing hockey with helmets on. And I would make the comment that hockey helmets probably protect more than a football helmet does. Soccer players wear nothing on their heads. So I'm struggling a little bit with allowing fall sports to happen and thinking about holding these kids back from winter sports. I think it's really unfair. So that's all I wanted to say.
Thank you. Do we have anybody else here that would like to make a public comment? Mr. Dunn, do we have anyone else that has a hand raised or a phone call? Okay, in that case, then that'll be the end of our public comment section, and I will, I will open it up to the board for discussion or for motion. Mr. Croto.
Okay, as long as everyone's had a chance to speak, and we can make a motion at this point now, and then board members will be able to chime in as well. So I'd like to move that the Concord School Board approve the playing of all winter sports and co-curricular activities for the 2020-2021 season, with full understanding that the season for one or all sports can be immediately canceled for any COVID-19 reasons.
Okay, the motion has been made, and hopefully Lyndon has gotten it written down, but Mr. Croto has it there if we need him to come back with it. Is there a second?
Second.
It is seconded by Ms. Higgins. I will now open it up to the board for discussion of the motion. Ms. Poinier.
Can someone please list the co-curriculars? That's kind of a big, broad thing to say, oh, sure, when we don't even know what we're talking about. Are we talking about all the clubs, musical theater, everything?
Superintendent or Mr. Reardon, can you answer that question?
I hope we're talking about everything, because for even the most, for want of a better term, obscure club or organization is important to the kids who participate in it. Probably just as important, maybe more important than hockey is to hockey players. So yeah, my fervent feeling is that there has to be across the board. The clubs, organizations are just as important as our sports. I don't, off the top of my head, Liza, I couldn't possibly remember all of them, but I can get you that list tomorrow.
Thank you. I would just like to add that if we're opening up all this stuff, then we got to open up the science labs, we got to have architecture class, we got to do everything we can to keep CRTC live. I think this is a very large can of worms, and I think that we need to prioritize education. Yes, as explained last week, co-curriculars are called co-curriculars for a reason. They're important, but there's a lot of safety factors with some of those clubs, and I want to make sure that everybody is doing absolutely everything they can if we're going to move ahead. And the idea that we would have people singing together but no science labs, to me, is ludicrous. Thank you.
Thank you, Ms. Poirier. Comments or discussion from any other board members? Sorry, I have to look all around. Ms. Walsh.
Thank you. I want to echo Liza's comments that I would really like to see kids back in school for a science lab. I'd like to see kids back in school, period, but at least for science labs and stuff. Earlier this week there was an article with about the American Academy of Pediatrics Youth Sports Guidelines, and the co-author of the study and the recommendations is letting her teenage daughter play indoor basketball. And that speaks to me about the choices that families are making, measuring the risks. And quite frankly, I think kids have been much more responsible throughout this pandemic than adults. And they should not pay. The transmission isn't coming in our schools, it's coming in the bars. And I don't think we should make kids pay for the poor choices adults are making. And I think we should not ask them to choose between school, in-person school, and sports, because we're not telling kids that are doing other activities or going to other riskier places, that they can't come to school. The kids that will play in Concord High, Concord RMS sports, will probably be the most supervised and acting the safest of all students, because they value this so much and because their coaches know what's at stake. I don't know if that's happening when they go other places, so I wouldn't make them make that choice either.
Thank you, Ms. Walsh. Ms. Pooney, I'll be with you in a moment. I just want to give some of the other members a chance to speak first. Mr. Crush.
Yeah, thank you. So this is a really phenomenally difficult decision. Listen, I am a big fan of parent choice, certainly with my own children. That's an inherent value to me. On the other side of the coin, I'm weighing that we're in the middle of a pandemic and we have public health concerns. I guess my question, and I want to be clear here, is with the motion that Mr. Croto made. And I changed my mind 15 times tonight, just to be clear. I guess my question is that we're not making, because I've heard Liza and Pam mention, opening up architecture, science labs, and things like that. We're not attaching any of that to Mr. Croto's motion, are we? We're purely voting on winter sports and co-curricular activities, correct?
To the best of my knowledge, Mr. Croto, is that accurate?
That's absolutely accurate, and with all due respect to Ms. Poyer's concerns, I think that should be taken up at a separate, separate session because they're very valid concerns. But I'd like to limit this particular motion to, just as I've stated, co-curricular for Concord High School and winter sports.
So thank you, Mr. Croto. Unless there would be an amendment to this, that it is currently addressing just winter sports and co-curriculars. Mr. Crush.
And we're only discussing Concord High School, not Runlet, correct? Are we doing both?
Both.
My motion didn't say it, but I would imply that it would be for both.
Okay.
Based on information we heard the other evening.
Okay, no, that's fine. I was just getting clarification. Thank you. And thank everyone for coming out and speaking passionately. And this is a really hard one for me, and I usually know where I land, but this is a hard one. Thank you.
Thank you. Yes, Superintendent.
I need to remind the board that we went to remote learning because of operational reasons, not for safety reasons. Because we had a number of staff that were exposed by another adult, and as a result, they had to go into quarantine, and we couldn't keep the schools running. I didn't have a principal, I didn't have an two assistant principals, and a special ed director at one of the schools. I had no choice. I just want to be clear that this has not been around safety. They have continued to do a fabulous job at keeping the protocols and the kids safe. And so I just want to be clear about that. I would absolutely love to have the kids back in school in their science, in their chemistry labs, in their physics labs, in their architect labs. And I keep my fingers crossed that we're able to keep CRTC opened. And he's done that because he has every single staff member present and accounted for, and that's what's made the difference. I just wanted to be clear about that. Thanks.
Thank you, Superintendent. Other board comments? If you can see one that I don't. Ms. Poinier.
Not as a part of the motion, just a suggestion that the administration consult with Dr. Noble about a possible testing regimen for student athletes and CRTC kids and other students who are attending school in person during remote. Thank you.
Okay, that is a good point of discussion, and we will bring it up later after this motion. Is there any other comments? I will say that I want to thank especially all of the students that have shown up tonight and made their comments and their thoughts known. I personally agree that the students are safer in our program than in any of the other programs. I think, they get the point that they've got to comply with all of the restrictions and regulations, and that, they owe it to not only themselves but their teammates and their fellow classmates. As a board, we certainly recognize that the parents here of these athletes should make a decision and have an input. We have to represent the parents of all the other students as well, which is what makes this such a difficult decision. But I think every one of you will have the discipline to adhere to the restrictions, and that more than that, you'll be honest in that if you're feeling sick, you won't even come to practice to begin with, and then abide by those. The very detailed outline of how we would conduct and the protocols for the athletes, I think was very thorough and most impressive. Superintendent, I would very much like to see the items for the co-curriculars too. I think every one of those students needs to always be wearing a mask and be safely distanced whenever possible. But I am in favor of Mr. Croto's motion. So do we have other comments or questions? In that respect, I think that we have concluded the discussion, and Ms. Higgins, will you please call the vote and record the vote for this motion?
Nay. Liza?
Nay.
Tom Croto?
Aye.
Mr. Richards?
Aye.
Ms. Walsh?
Aye.
Ms. Smith?
Aye.
Mr. Parker?
Mr. Parker, you're still muted.
Sorry, aye.
Okay. Mr. Crush?
Aye.
Ms. Cannon?
Aye.
And I say aye. So the motion passes 8-1.
Thank you. So the motion passes. Do we have any other business? We do need to go to a non-public session at the end of this meeting, but is there any other business from the board that they would like to bring up at this time?
Jim, yes, Chuck, I'm raising my hand. I just want to get it out. Back to Laz's point about consulting with Dr. Noble and testing, can we make that a motion? That the administration pursues research of a testing protocol for students involved in these programs, at least for a discussion, and maybe report back to the board on a plan?
I believe you just did make the motion, Mr. Crush.
I'll make the motion, yes. I'll make that motion, yes.
Okay, Mr. Crush has made the motion that we instruct the administration to investigate testing and protocols associated with testing involving these sports. Is that fairly accurate, Mr. Crush?
That is, yes. Thank you.
Do I have a second for that motion?
I'll second it.
The motion is made by Mr. Crush and seconded by Ms. Cannon. Is there discussion among the board? And I will look around to try to see as many hands as I can.
I guess
Mr.
my
Croto?
only question about discussion would be, is this something that's clear and doable at this point, Superintendent Murphy? I know that you've always got the students' best interests at heart.
easy part is having a conversation with Dr. Noble. The tough part is that pulling that off. So give me a little bit of time here, and we'll meet with Jim and see what he has to say, and we'll get back to you. That's the best I can do. But again, people have to realize they can get these tests. They're at no cost, and there's a variety of locations in the general area that they can go and have tests done. So if people are concerned, first and foremost, but we will get back to you with advice from Dr. Noble.
Thank you. Yeah, and thank you. Just to clarify, my motion is not to implement testing, it's to have the discussion and present information to the board.
Yes, I believe his motion was to direct the administration to investigate a program of testing and to report information back to the board, not to actually implement anything. Do we have any other discussion? In that case, I will call a vote on the motion. Ms. Higgins, will you take the roll?
I will. Ms. Ponier? Aye. Mr. Croto?
Aye.
Mr. Richards?
Aye.
Ms. Walsh? Aye. Ms. Smith? Aye. Mr. Parker?
Aye.
Mr. Crush?
Aye.
Ms. Cannon?
Aye.
And I'll say aye. So 9-0. Keep us informed.
Motion passes.
Thank you.
Is there any other business before the board for this evening? Any members have? Looking around and not seeing any, I would like to make the motion to go into a non-public session for the purpose, and thank you all for coming, and
Thank you.
have a safe season. All right, I would like to make the motion to go into non-public session pursuant to RSA 91A and, oh, here we go. So much better. Section 91A:3, Section 2, C, matters which, if discussed in public, would likely affect adversely the reputations of any person other than a member of the public body itself, unless such person requests an in-person meeting. This exemption shall extend to any application for assistance or taxable abatements, waiver of a fee, fine, or other levy if based on an inability to pay or poverty of the applicant. Do I have a second?
Second.
Okay, the motion has been made and seconded. This is a roll call vote, so Ms. Higgins, would you call the roll? And then if we do go into non-public, Mr. Dunn will let everybody know how to do this remotely.
Yep.
Wait a second, Jack.
I am going to email those board members that are remote. I am going to email you another link.
Okay.
I can't take the chance somebody's on this one.
Okay, that's
I
fine.
created it.
So
I'm gonna send that now.
can we call the vote?
Ms. Ponier?
Aye.
Mr. Croto?
Aye.
Mr. Richards?
Aye.
Ms. Walsh?
Aye.
Ms. Smith?
Aye.
Mr. Parker?
Aye.
Mr. Crush?
Aye.
Ms. Cannon?
Aye.
And I say aye. Excellent.
Okay, so at 7:18, the board has gone into a non-public session. Do we need to, and Gino, you believe we need to seal the minutes in a public session?
I do.
Okay, so we voted to come out. Josh, will you put us into a public session again, and do our members here have to get into?
Yep, they have to go back to the other.
All right, you guys got to log out and get back to the old one.
I sent you the link. You have your rejoin the other session.
No, I'll look, but we'll try.
We're back from our non-public session. I don't believe we have any more business. And Mr. Croto, were you making a motion to seal the minutes?
I would love to make a motion to seal the minutes of our recent non-public meeting.
And pursuant to RSA 91A, colon 3, section 2C.
Perfect.
And second to that motion, Ms. Higgins seconds the motion. Would you, Ms. Higgins, would you please call a roll call vote for us, please?
Liza? Aye. Tom?
Aye.
Pam?
Aye.
Gina?
Aye.
David?
Aye.
Danielle?
Aye.
Chuck?
Aye.
Jim?
Aye.
Barb? Aye.
Okay. With that, I don't believe we have any other business, and I would entertain a motion to adjourn.
I make the motion to adjourn.
Do we have a second? Second. Motion made by Mr. Crush and seconded by Ms. Walsh. We don't need a roll call on this one. All those in favor say aye. Aye.
Aye.
Any opposed? We are adjourned. Thank you, everyone.
Thank you.
Thank you.